Now let's welcome Dr. Tim Murphy of Novant Health Family and Internal Medicine, South Brunswick. Welcome, Dr. Murphy.
Thank you. Lovely to be here.
I am so happy to have you here. I know we were together last week touring and we had such a good time.
We did.
And so I'm really happy that you were on the show today.
Thanks.
So I know there are folks out there who haven't met you yet because you're pretty new. So tell me a little bit about your background and your education.
Okay. Well, I'm from Buffalo, New York, and I'm married to my lovely wife, Donna, who is my everything. Time's about 34 years, and we have 3 beautiful children, 1 of each, just kidding. 2 boys and a girl, and we have a 3-year-old granddaughter.
And what's her name?
So the granddaughter is Ivy.
Ivy, how sweet.
Oh, she's a doll. She melts my heart.
I'm
anyway.
Sure. So where'd you go to school?
Well, I got my bachelor's degree from the State University of New York College at Buffalo, also known as Buff State to Buffalo folks.
Oh.
And then medical school was in Kansas City, Missouri. And then I did a family medicine residency, which is 3 years beyond your doctoral degree.
Right.
And that was done in Niagara Falls, New York. And that was a State University of New York residency. So that's pretty much it. And so I'm a generalist, or as many patients would say, oh, just a family doctor.
Oh, no.
Yeah, okay.
Just.
All right.
There's no just in there.
Right,
Yeah,
well, thank you for that.
Yeah, you do it all.
Well, that's exactly what, and I know this is one of the questions that I'm to field, why I got into family medicine, because I love having a broad-based foundation.
Right.
And that way, hopefully, prayerfully, humbly, I have an idea, no matter what someone comes in with,
Right.
Adult, child, man, woman, you name it, any patient coming in to see me, because I've got gray hair and it's real.
Me too.
Yeah, yours is nicer looking than mine. But I have an idea with, again, whatever people present.
Yeah. You know what I like most about family practice is that it's generational. You might see the baby all the way up to great-grandma.
Womb to the tomb, as they say. Yeah.
I think that's
don't
awesome.
deliver babies anymore. Thank you. I don't deliver babies anymore, but pretty much anything and everything else with family medicine.
Yeah.
And I love it. I just love it, especially connecting with the folks and hearing their stories that people very close with them may not have any clue about. But I get to hear a whole bunch in nanoseconds practically.
That's true. Yeah, that's true. Well, I'm curious. What brought you to this area? Why Brunswick County?
As I said, my wife and I have been married a little over 34 years, and when we were first going together, we came down from Buffalo, by the way, during blizzard weather. It was literally feet of snow, and we came down south, about a 14-hour drive to get to the coast. Holden Beach is where we ended up, and because one of my wife's friends, who was part of our foursome, she was in a wedding down here. She's originally from Holden Beach, and I could not believe that we were wearing T-shirts and shorts on the beach, not swimming, but you know, this was February, blizzard weather in Buffalo, and we come down here, and it's beautiful blue skies, sunny. So many, many moons later, my wife and I decided it was time to come down here.
Sure. Let's talk a little bit about your clinic. And I know you're crazy about your clinic, and I know you've only been here a few months, but you absolutely love your clinic. So tell me about the clinic.
They're indescribably kind, gentle, dutiful, just magnificent human beings, and I am humbled by their humanity, I would say.
Yeah. And it's in South Brunswick, right?
Yes, ma'am. Yes, it's in Calabash. the thriving metropolis of Calabash.
Yeah, and we call it South Brunswick.
Yes, ma'am. So it's South Brunswick, family medicine and internal medicine in whatever order. But we have just a wonderful staff, as I mentioned, and I've thoroughly enjoyed working with them. Everybody is so helpful, so quick to assist with whatever I'm asking.
Right.
And it's usually something with the computer, of course.
Of course.
Yeah. But, you know, clinically in whatever manner, they're just
it's
wonderful, wonderful people.
It's a great practice.
Yes,
We're
ma'am.
really excited to have them as part of Novant Health. So let's talk about coronavirus for a little bit. I know that you've probably seen some patients who maybe have delayed care because of the coronavirus, and that's not a good thing. So what would you recommend now to patients that are due for their annual exam? Is it safe to go to the doctor?
It is, to the extent that at the door, folks are screened for the coronavirus. So whoever is staffing the door, literally the front door of the clinic, they're you know, questioning folks who are coming in for a doctor's visit, whether it's an acute visit because they hurt their elbow, or a routine scheduled follow-up for their hypertension, diabetes, cholesterol, and so on. And so people are screened. So to the degree that screening can assure a safe environment, that's the rule. Now, as I think most people realize, because there's been a lot of discussion about coronavirus, unfortunately, we don't know a whole lot about the coronavirus, but we know, and I'm sure you know most of the public knows, that it's a little too easy to contract that viral infection. That said, that should not delay anybody from seeking out their usual follow-up appointment or an acute visit or what have you. Everybody wears masks, and if there's any question about a given patient coming in, possibly having coronavirus exposure, then that's addressed then and there. The behaviors that everyone has heard about, they're called mitigating. But in other words, that which lessens the risk of transmission, we recommend highly, highly, highly. And please, if nothing else comes of this, masks must be worn, must. And I respect people's protest of wearing masks, and that's my right to behave the way I want. But in fairness to everyone involved, no one has a right to make somebody else sick. So I say that with due respect and love in my heart towards everyone, but you have to wear a mask.
Please wear a mask.
There's no way around it. And then you need to wash your hands, and always have some bottle of whatever sanitizer on your person or in your car, wherever you're traveling. You need to have that, and slather your hands and clean them properly. And finally, of course, social distancing. And those things work. They work. They work not just nationally, but internationally. And so they have to be employed.
Well, Dr. Murphy, it's been a pleasure to have you here, and I know that you're taking new patients.
I am.
And so we'll run a trailer along with the phone number so they know how to contact you.
Thank you.
And I wish you all the best. And
I'm grateful. Thank you.
You're quite
Miss
welcome.
June, I should say, has been extraordinary. And she has taken me on a number of tours.
You're so
One
funny.
was to Atlanta. No. But anyway, I so appreciate you. You have no idea.
Thank you.